On Health Trail today, we trail discordance in HIV and AIDS. One thing I like about Health Trail is that it demonstrates in a very clear and practical way how people are living and dealing with the challenges of health that we come across every day. I'm your host, Chama Kalima. Come with me as we meet Akim Sakala.
In the heart of Lusaka's Kalingalinga compound, Akim Sakala takes his 6th grade pupils through their English lessons. Here, Sakala is a popular teacher among his pupils, not because of his jokes and fatherly approach to teaching, but he has openly told them about his HIV status. He is positive. But his wife, Juliana, of 23 years, is negative, thanks to a consistent usage of condoms since her husband knew his status 11 years ago.
I had a lot of bouts of malaria, and at one time I was suspected to have ulcers. In most cases, each time I slept, I would sweat a lot. And these brought a lot of questions to myself, why these things were happening to me. And that is what prompted me to go for an HIV test.
He says breaking the news about his newfound status was not easy.
Immediately after testing, when I came back home, I had developed a hiccup right at New Start. So when I came home, I shared with my wife. But that time, I had a hiccup which was continuous. So my wife, I think, concentrated on the problem that was seen. That was the hiccup. Basically, my wife concentrated on seeing to it that the hiccup was contained.
The Sakalas, who have 5 children together, often have to fend off stigma from the community about the status, but speaking openly about AIDS eases the burden.
Knowing that I am positive and my wife is negative, I think it is one thing that I feel I have the virus. I should not transmit it to my wife. So that alone keeps me to be consistent and make sure that we use the condoms correctly.
But first ninzoyopa, but kukonka kuti ndine muntu naine nazi batabantu bamuna banga vachitika badwala so palibe vemene ngachite, but through counseling mamene vanatupunzisira ma doctors using a protection and using a bwino. It's not easy, but ni kumvera na chabena na kunkana chikurupirira.
Juliana knows the dangers of having intercourse with her HIV positive husband, and as such, she undergoes voluntary counseling and testing at least twice a year to keep in touch with her status. She told me how she feels each time the results come out negative.
Nimamvera bwino.
Just like she doesn't ever imagine being positive one day because she correctly and consistently uses protection.
Because it's a protection and T7 is a correct.
Discordance in HIV and AIDS is a phenomenon that is not quite well understood by a lot of people. And I am glad that I could have this time with our Health Trail doctor, Dr. Manasa Piri, to just make us understand how it just happens. Doctor, thank you so much.
Always my pleasure.
Indeed. Take us through the science, doctor, of discordance. How does it happen?
First of all, the word discord, it's a word that we've known for a long time in music when things are not quite in sync, not quite in harmony.
Yeah.
So where HIV infection is concerned, discordance refers to a couple who are married or not married but in a relationship and having sex, and one of them is HIV positive and the other is not. And they can remain like this for quite a long time, 10, 15, 20 years or more. And they continue to have sex together, most of it probably unprotected. And the one who is negative still remains negative. So to explain it further, the opposite of discordance is concordance. So you can have a couple who are both HIV positive, so they're concordant positive. So discordance refers to one person in a relationship remaining negative while their partner is positive. Now, the science, how does that happen? If we knew, then we wouldn't even be discussing it. Because if we knew, we would have the answer to how to continue to protect those people who are HIV negative from becoming infected. If when we find the answer to this, we'll probably be very close to finding a vaccine, to finding something that we can do with people who are negative, that we can give to people who are negative so that they remain negative. What we also don't know, and this is a very important point, is how long in a discordant relationship does the negative person remain negative if they continue to be exposed to the virus. We don't know. We don't know how many turn positive. We don't know how many remain negative. You know, the fascinating thing about working in HIV is we are learning new things every day. Yes.
Yeah, indeed, very interesting. So there's no guarantee that if I am HIV positive, then definitely my partner will also be HIV positive. It's not.
No, there isn't.
Yeah.
There isn't that guarantee. And by the same token, there is no guarantee that if I am HIV negative, therefore my partner is also negative. You know, when we started to work in HIV in the 80s and the 90s, a lot of the young men in marriages used to shun the HIV test and test by their wife. So if the wife gets pregnant and she has a baby and the baby survives, they assume that they must also be negative. And when we started to do prevention of mother-to-child transmission, the wife goes to antenatal clinic, she tests negative, therefore the husband assumes that he is also negative. It doesn't work like that.
It doesn't work like that.
It is possible for him to be positive, for his wife to be negative, to give birth to a negative baby while he is positive. And he can, at some stage, she may convert and become positive. So the only way to know what your status is, even when you're in a relationship, is to have your own test done and your partner's test done, preferably at the same time.
Okay. You've just said, doctor, that over time she may, or the negative partner may or may not convert.
Positive.
Convert to a positive status.
Right.
So then if I am HIV negative and my partner, my husband, is positive, do I don't just sit there, do I have to keep taking tests?
Yes, you do. First of all, you don't have to keep taking tests. You have to continue to protect yourself. You have to continue for him to use protection, or for you to use protection every time that you have sex, so that you don't increase your chances of seroconverting or becoming positive. The question comes when you want to have children. You are negative, he's positive, and you want to have his child. That's where you need to go together to your doctor or your health provider, who will then teach you how to, shall we say, have sex carefully, unprotected sex carefully, and only at those times when you are most likely to get pregnant. If you don't, you go back to protection. The next month, you try again. But that has to be with the help of a trained health professional. But always use protection.
Researchers have yet to fully understand why the AIDS virus is not transmitted between discordant partners. What scientists do know, however, is that HIV discordance is related to a combination of factors that include genetics, the HIV virus type, and the extent to which the infection has progressed in the HIV-positive partner. Circumcision, which research indicates reduces the risk of HIV infection by 60% in heterosexual males, also helps. But it must be noted that being circumcised is not a passport to having unprotected sex.
Those that are infected, it is important that they actually consistently use medication, which is ARVs. And the usage of ARVs actually has also proven to reduce the chances of transmission. A small research that was done in Uganda showed that there was absolutely no transmission or no rates of transmission in individuals that were consistently reading 1,500 copies of viral particles per meal. So it's important that those that are HIV negative in a relationship where the partner is HIV positive to continue and consistently use the ARVs.
We also now have a drug on the horizon. It is in Zambia. It is used as part of the armory of antiretrovirals that we're using. But it has just recently been approved in the United States for use for the prevention of HIV in people who are in discordant relationships. It hasn't yet been approved for that purpose in Zambia yet. It is now only used for the treatment of people with HIV.
Okay, so were it to be approved for that purpose, then a person like Juliana, you know, in the clip, would go on the trip.
But they must still continue to use condom.
Protection.
Yes, absolutely.
Okay.
Yes.
Now, it brings me to the other question of family or spousal support. It's very key in health interventions. And we've heard of stories where one partner would desert the other, or the marriage would end because
one has tested positive. And so on. That's very important. Very, very important, because the negative side of it is that we have seen many, many cases of men or women who test positive and don't want to tell their partner. So they're taking their medications in secret and in private, and sometimes they miss doses because they don't want the other partner to know that they're taking medication. We've had cases of people who hide their antiretrovirals in the bag of Millennial, you know, and that is not necessary. Because if people support each other, whether positive or negative, whether both positive or both negative even, then they can help each other to ensure that the one who is negative stays negative. So the support is very, very crucial. Support of the partner, but also support of the family. So children who are at an age where they can understand what is going on should be told whether the couple, their parents are concordant positive or they're discordant. The children should be told that this is a situation. We have found ourselves where your mother or your father is positive and the other is negative, or where we're both positive. And we're going to need your support for us to be able to carry on living, for us to be able to carry on looking after you in a healthy manner. And it can be done. It so reduces stigma and so on.
So disclosure must precede.
Absolutely. Disclosure must precede everything in HIV. And that is why we encourage people to test together as couples, so the disclosure is done right there for them. And also they are counseled on how to continue in a loving relationship despite the presence of the virus among them or between them.
Thank you very much, Doctor.
My pleasure.
We'll see you again soon.
As always. Thank you.
Back to the Sakalas, they believe the issue of HIV should not be addressed at family level alone. Their daughter thinks it's also about national leadership.
What I think leaders should do is let them be examples to us by going for tests, and if they turn out to be positive, let them speak to the public and tell them that I am HIV positive, so that they can be role models to those that do not want to go for tests.
This is Kennedy Gondwe reporting.
Thank you for being part of the trail today, and it's very important for the family to stick together in such instances. We look at the family of Mr. Akim Sakala, and it's just a pleasure to see and very encouraging for anyone that may be going through the same situation. We'll see you on the trail next time.